That's you? No, that's you.
No, that's Thank you.
She said we were getting an exclusive. No. No problem.
All right. Thank you, sir. We all good? Everyone's all set? Okay. Thanks everyone for being here. So last Friday, as folks know, we shared information on the temperature excursion incident that impacted individuals that received the Pfizer vaccine at 54 Meadow Street from the New Haven Health Department between December 23rd and February 7th. Just a reminder about this, incidents of temperature excursion where the vaccine isn't properly stored at a certain temperature. There's a number of those incidents that have happened around the nation, and there is no evidence that that impacts people from a health perspective. It may impact the strength of the vaccine. In our case, these vaccines were in the freezer too long, and Director Bond is going to go into a little bit more detail as we've spent more time doing this review. DPH, Connecticut Department of Public Health, and Pfizer have recommended that the individuals that were impacted and received these vaccines simply get another shot. We're here to give an update on a number of things that the city has done since last Friday. And I'm going to, before I hand over to Director Bond and Dr. Dalal, I'm going to just go over kind of high level what we're going to cover here. One is communication with the individuals who received the doses of the vaccines in question that were not properly stored. Two is an internal, and that's going to be covered by Director Bond. Two is an internal review to collect more information, understand what occurred, and identify if there were any other issues. Director Bond is also going to go over that. And three is review our vaccine storage and handling protocols and procedures. At my request, the Connecticut Department of Public Health came down, and their site review team was here today looking at those protocols, and Dr. Dalal is going to go over what they found. So I'll start by handing it over to Director Bond.
Thank you. Good afternoon. I thought that before I actually go into my internal review, I thought that I would begin to talk a little bit about what the vaccine storage protocol is, and then delve into an update on our internal review. So typically when we receive vaccines, they're assigned either by the primary or backup vaccine coordinator, and we verify the inventory quantity and the lot number. We verify the delivery temperature to ensure that they're adequate. We then place the vaccines in the appropriate storage unit per the manufacturer's guidelines. And if vaccines need to be moved from the freezer to the refrigerator after a certain period, the date on which the vaccines should be transferred is written on the vaccine package. Each COVID vaccine has a different storage protocol. For instance, the purple cap for Pfizer can be stored in the freezer for 14 days and then moved into the refrigerator for 31 days. Which actually recently transitioned to the gray cap, which must always be stored in the refrigerator. Upon our internal review, an isolated incident of vaccine management involving a lack of clear communication as to responsibility for checking the time for moving the vaccines from the freezer to the refrigerator was identified. Approximately 2,900 doses of Pfizer were left in the freezer too long. Of those, 656 doses were administered to 625 patients. We cross-referenced those individuals with the state database, and none have been identified as having gotten COVID-19 unless someone had a rapid home test, which we are not able to track. As of today, we have been able to reach 61% of the patients, and 95% of those individuals had no medical concerns. Letters were mailed out to all patients, and those without phone numbers or incorrect phone numbers were sent a registered letter. Revaccinations up to date are 19 patients who have visited our clinic and have been revaccinated. With that, I'm going to turn it over to Dr. Dalal to talk a little bit more about the Department of Public Health site visit.
Good afternoon. At 11 a.m. this morning, Director Bond and I met with the DPH site visit team here at 54 Meadow Street. We understood the comprehensive nature of their review would include a CDC-based template to review all aspects of vaccine handling, storage, and the protocols related to the communication about those vaccines and the storage and handling. Upon the conclusion of the review in the afternoon, I placed a call to the site visit coordinator. She communicated to me that there were no findings of concern, save for one, which was a circuit breaker that lacked a label that said "do not disconnect." This circuit breaker is connected to the fridges that store the vaccine. So we will take corrective action as soon as possible to make sure that label is placed. They will be providing a final report. We anticipate that report coming next week. And when that report is available, we will obviously address any new concerns that are identified in the report, if there are any, and we'd be also happy to share any new findings that come up in that report. Thank you.
Thanks. Before we open up to questions, in addition to the internal review that has been conducted by Director Bond and the Department of Public Health review, the city is undertaking an independent review of our employees and contractors' conduct leading up to the discovery of the temperature excursion. Once we have the results of that review, we will determine what next steps, if any, need to be taken to ensure accountability. The independent review will be done by our outside contractor, New Light Investigations, which has been assisting the city with other labor matters. Any questions from folks?
A few. Maybe I'll start with the mayor and then a few for Director Bond. And first for you, Mayor, is about the recommendation that these 625 people get revaccinated. Is there any risk that someone faces getting vaccinated so recently after getting vaccinated by a potentially less effective dose? Now, of course, the pandemic, if you got Pfizer, you had to wait 3 weeks, you wait a couple months to get your booster. You all have been saying that the doses were rendered potentially less effective because of the storage issue. Should people be concerned about getting vaccinated again so soon after getting
So that's more of a health question than, so Director Bond can address, but we specifically, as you recall, on Friday, did not provide recommendations because we were waiting to hear back from the experts, the manufacturer of the vaccine and the Department of Public Health. And what they told us is that people can receive an additional shot immediately. I don't know if you have anything to add there.
So as you know, we were awaiting to hear from Pfizer on formal written recommendations, and the recommendations is that there was no medical harm, but that individuals can get revaccinated immediately. And so that did occur, and so throughout the weekend, we made sure that we had made contact with individuals and shared the percentages of our success in being able to reach those individuals. You want me to just stay here?
Yes.
Okay.
Thank you. It's a very helpful explanation of the city's storage policies right now and what you all do and what happened, the specific 2,900 or however many doses.
Correct.
So just so I have it straight, these doses were stored in the freezer for 2 weeks, but then they weren't taken out of the freezer after those 2 weeks?
Correct. They were just kept in the freezer longer than the recommendation from the manufacturer.
Got it. So they should have been moved to a fridge after those 2 weeks?
Correct.
They were not. So they were in a freezer for the full 2 weeks plus 46 days of the period of concern? Is that
Correct.
Is that right? That's correct.
Correct.
Okay. You said a miscommunication was discovered. I don't really know what that means. Miscommunication between who? I understand you're
There was a lack of communication between personnel.
Okay. Between city health department personnel who are responsible for moving the vaccine out of the freezer?
Correct.
So we're reluctant because we have not yet begun the review of employee conduct. That will be an external party, as I mentioned, that will review it. We're reluctant to get into a lot of details of personnel issues. I've been mayor for 2 years, which isn't a long time, but there's been countless times where there's more to the story once you interview a lot of people and get more information. And so while it's tempting to jump to conclusions and want to say that this person did this or that person did that, we want to be just very cautious that we do things properly. And so it is clear that there was a lapse in communication, which meant that the vaccines were not transferred properly in the right time. But at this moment, we don't want to get into a lot of details on employee issues before we make sure that that process takes place.
Thank you. And Director Bond, you mentioned that you all have reached out in some way and you've made contact with, there was some percentage, it was like 61%?
Correct, 61%, and we continue to actively contact individuals that we've left messages for, and I want to make sure that we reach everyone.
Then you said that 95% didn't have medical concerns.
Correct.
What does that mean, and what about the 5%?
So we were very fortunate that the community did not have any medical concerns. In fact, we've had some individuals jokingly say, this stuff like this happens, and they were just very receptive and came in to get revaccinated and are coming in to get revaccinated. And so I want to thank the community for understanding. And then the 5% that did, we just needed a follow-up call with the nurse so that we can be able to clarify any questions that they had.
Well, what does that mean? What does medical concern mean?
They just had medical follow-up questions from the staff that was calling over the weekend.
Oh, I see. So it's not that they had COVID, it's that.
Zero, so as I referenced earlier, when we cross-reference to our database, no one has contracted COVID from our database from a PCR test, unless they took a home rapid test, of course. But no one contracted COVID from that time period when we referenced it across our surveillance system.
But he's trying to get to, so when you say medical concerns, it means someone had additional questions?
Someone-
That needed
Correct.
someone with more health expertise to
Correct.
call them back? Is that
That's exactly correct. And so when individuals had, so they just flagged so that a RN was able to then follow up from the support staff that were calling.
And my last question for right now is, so Director Bond, you found out on a Tuesday about this problem, and then the mayor didn't find out until Friday. If I have that correct?
So let me clarify.
If that's true, why did you wait?
So let me clarify. So on Tuesday, I was informed of the temperature excursion only. I then immediately,
Informed by who? Informed by a deputy of yours, informed by city staff?
so I was informed by staff about the temperature excursion, and then we began the full assessment on whether or not individuals were affected by that. I received the report of individuals affected on Friday morning, where I then immediately notified the mayor and Dr. Dalal also. However, simultaneously, because of the temperature excursion, we have to report that to the Department of Public Health, and we also contacted Pfizer simultaneously. So we were awaiting a response to what to do with the vaccines, on which way to return them, so that we can be able to then handle it. But in the interim, in those 2 days, we were then identifying whether they were administered to individuals, and received that report Friday morning
But you received that report from whom?
from staff
From staff, okay.
Correct.
So you got a report from staff on Friday that
about individuals affected. And then we received a response on the recommendations from Pfizer that evening.
I mean, did you recognize immediately that this was a potentially really big problem? And if so, why not let the mayor know even before you had the final results?
I did not know the extent of the issue, other than that there was a temperature excursion, and so we needed to gather that information.
Community members have been critical that the city didn't act quick enough. Do you feel like you acted quick enough in this instance to let the community?
Absolutely. We could not make a recommendation to the public unless we had that written statement, and so that did not come in until Friday evening. We wanted to make sure that we provided the proper guidance that needed to happen.
And what's the timeline on the DPH investigation and your investigation with the city to try and figure out if there's going to be any accountability?
The DPH investigation is concluded. They will just be writing up their final report and giving us, so we anticipate next week.
Next week, okay. And then for you, Mayor?
So it depends. So it will start in the coming days. We're hoping on Monday it will start. It depends, right? Because it depends on, there'll be initial interviews of some employees, and if they need to interview other employees, then it could be more time. As you all can imagine, I think that, speaking for myself, I'm very anxious to identify if there were any specific issues and make sure that we move this along as quickly as possible.
Mayor, do you think that Director Bond should have let you know on Tuesday or sooner?
There's always a balance between what to bring to my attention and not. I like to know things as soon as possible. So I encourage all of our staff to share things as soon as possible. Of course, I can't know everything at once, but I think it's pretty safe to know that, or safe to say that I'd like to know things quickly.
Do you have a message for people who were thinking of coming in Haven to get their shot and now might be feeling a certain way about it?
Yeah, so our health department has given out over 23,000 vaccines. And there was an issue here We quickly responded to it and corrected course. As mayor, it is the highest responsibility of mine to make sure that we keep the community safe. I've received my vaccine from the New Haven Health Department. My daughter has received her vaccine from the New Haven Health Department. When it's time for boosters, my daughter and I will again receive vaccines from the New Haven Health Department. I think that this process in many ways happened as it should. We identified a problem, we quickly reacted, we shared it with the public very openly, and we corrected course. And I think that should give people comfort that the people that are making decisions here deeply care about the integrity of our health system.
So there's still over 600 people who have not yet been revaccinated, it sounds like.
It's hard for us to know, right? So because they could go anywhere, right?
Or at least according to the records that you're able to access. Like they haven't gotten
We
revaccinated.
can give you a definitive number.
Yeah, Director Bond said I think there was 19 have come here, but people could have gone to any number of other places to get vaccinated, right? There's plenty of other places for them to get vaccinated. So we don't know the answer to that.
But for that group that has not been revaccinated, still it seems like it could be in the hundreds. I mean, they still have little CDC cards that say they received X number of doses from the health department, whereas now that last dose may not be right. So I don't know. Or maybe less
There's no
effective.
evidence of the efficacy and the revaccination is a recommendation as an option for individuals to be considering getting
But
vaccinated.
they should correct that when they come in and get their next
And
shot.
we will update them, we certainly will do that.
Is there a timeline of when it's like too late or too soon to get revaccinated in this case?
No, it's immediately because Pfizer and the Department of Public Health have advised us that residents that have been in this category can get revaccinated or can get the shot again immediately. Just a point for people to understand, the majority of people that in that 625 person number were receiving their booster shot. There was a smaller number that were receiving either the first or second dose, and a handful of people that received both the first and second because they received in this time window, the first early on in the time window, and the second when they came in again. You got a question?
By leaving it in the freezer longer than normal, was it rendered ineffective or partially effective? Do they know?
There's not enough research on that yet because with most things in the pandemic, a lot of things are new, right? And there has to be a lot of research done, and these folks can talk about it more than I, but we do not know the
I
answer.
wanted to talk about it. If you don't know if it was effective, is it 90% effective?
There is-
30%. If I get a second booster, did I just get 200%? Or
So-
175?
So the short answer is that when we were awaiting recommendations from Pfizer, and when we received the recommendation from Pfizer, there was no efficacy data to determine that. So the recommendation is to revaccinate.
I would add that we have also communicated very clearly, both in the calls and the letter that's going out to the affected individuals, that if they have any questions, they should contact their healthcare provider for further guidance and advice around their decision to take this recommendation or not.
Mayor, how do you feel about this? How big a deal is this? And as you said, Fort Park has handed out some great deals.
Yeah, I think it's a big deal. I think it's a big deal, especially because there is a good group of people out there that are pushing conspiracies about vaccines, and it is vital that people have confidence in our health system. And I know that the team here is working very hard and has been doing so for the last 2 years to keep our community safe. One incident like this can erode confidence. And my hope is that people see that we are committed to correcting this error. Frankly, I'm very grateful that no one got hurt. And I think that our response needs to be strong, quick and decisive in order to ensure that and show the public that we will correct these kind of errors when they happen. Thanks, everybody.
Thank you.